can be converted to digital with a set-top box which you can get at the warehouse for as little as $79. The government is yet to take any decisions on the possible form of any assistance package.
Question number 12, Grant Robertson.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by his statement to the Cabinet Expenditure Control Committee that, quote, we may need to take some tough choices regarding the scope and range of services the public health system can provide to New Zealanders?
The Honourable Tony Ryle.
Mr Speaker, within context, yes.
Grant Robertson.
Supplementary question. Is one of the changes to the scope and range of services he meant the cutting of beds, emergency department and palliative care services at Hawara Hospital, which have been described by the chairman of the Ngāti Ruanui Runanga as, quote, a drastic and unacceptable reduction in health services?
The Honourable Tony Ryle.
Mr Speaker, there is a consultation currently underway on services at Hawara. The proposals do include the maintenance of maternity beds, palliative care beds, short-stay emergency department beds are all in the plan, along with after-hours GP services. The Government and the District Health Board believe that the people of South Taranaki deserve a better facilities and services, and we are consulting on those.
Grant Robertson.
Mr Speaker, how can he interpret the people of South Taranaki getting better services when he is cutting $1.1 million worth of services to Hawara Hospital?
The Honourable Tony Ryle.
First of all, Mr Speaker, $1 million is around about 0.3% of the DHB's budget. So the important issue here is that one of the biggest issues being faced by the people of South Taranaki, which we've inherited from the previous government, is difficulty with general practice access. And that is part of this plan, to improve general practice access, to also improve access to other specialist services, and the consultation's underway.
Chester Borrows.
Thank you, Mr Speaker. My question is to the Minister. What advice has the Minister received about proposed changes to health services in South Taranaki as to whether or not they are set in concrete, or is this a genuine public consultation?
Honourable Tony Ryle.
Mr Speaker, I've seen a number of reports. One report which said that the emergency services at Hawara Hospital were privatised to a private company under the previous Labour government.
Not even mixed ownership.
Privatised under the previous Labour government. And it fell over. I've also seen another report about a comprehensive consultation process underway with the people of South Taranaki about how best to meet future health needs. It's important to remember that no decisions have been made by the District Health Board, and the people of South Taranaki deserve something more future-oriented than what they have at the moment.
Grant Robertson.
Given that 8,000 people have now signed a petition to retain the services at Hawara Hospital, does he stand by the statement he, quote, repeatedly made to local MP Chester Borrows, as reported in the Taranaki Daily News last month, that, quote, health services in South Taranaki will not change unless the people want them to change?
The Honourable Tony Ryle.
Mr Speaker, that's why there is a public consultation underway. And it's interesting to note, I don't think there was any public consultation when the previous government privatised the emergency department at Hawara Hospital. Privatised without consultation.
Mr Speaker.
Is this supplementary... Oh, sorry, is
point
a
of
point
order.
of order on my left? Grant Robertson, point of order.
Order. Point of order, Mr Speaker. I know that I began the answer with the statement given, but it did then say, does he stand by the statement? And the Minister didn't make any attempt to answer that question.
The member's clever enough to know that once he starts a question given, he leaves a lot of scope for a Minister's answer. He leaves a lot of scope for a Minister's answer. Heather Roy, supplementary question. The Honourable Heather Roy.
Thank you, Mr Speaker. To my question to the Minister, can he advise whether one of the reasons that tough choices are required is the fact that the health sector suffered a 15% drop in doctors' productivity and an 11% drop in nurses' productivity under the previous Labour government?
Mr Speaker.
The Honourable Tony Ryle.
Mr Speaker, I am aware of the numbers the member refers to. Under this national government, we're doing 20,000 more elective procedures a year. There's 1,000 extra nurses and 500 extra doctors. We've put in place programs to make wards more productive. This is being led particularly by nurses. And we've seen a remarkable improvement in waiting times in emergency departments, cancer treatment times and immunisation rates. I think productivity is on the way up because the clinical staff of New Zealand know they have a coalition government that is prepared to back them and their services.
The Honourable Heather Roy.
What is his best estimate of the number of operations and procedures that were lost as a result of the massive fall in productivity under Labor? And are there any estimates of the pain and suffering this caused people to New Zealanders?
Point of order is called. The Honourable Trevor Mallard.
Speaker, I'd ask you to rule whether the insertion in that is necessary for the question, and if not, sir, I think you're obliged to rule it out.
My goodness, would the member really want me to rule out insertions into questions on a regular basis?
To order.
Before I hear the Honourable Member, the question asked the Minister what is the advice he's received on the reasons, was it, for the reduction in productivity. Now, in answering it, he will need to be careful because he is not responsible for the policies of the previous government. He can report on any advice he's received, but he mustn't give any personal views about the previous government. That's not his responsibility. The Honourable Tony Ryle.
Mr. Speaker, in seeking to obtain an estimate of the number of operations and procedures that were lost as a result of the massive fall in productivity under the previous Labor government, that is difficult to estimate. But I suspect a number that would be appropriate is the number 30,000, which is the number of patients culled off waiting lists under the previous government, even though they had been promised that they would get treatment.
Shame.
That brings to
Say sorry.
order. Order. Is this a point of order?
Order.
Point of order. The Honourable Heather Roy.
Thank you, Mr. Speaker. I seek leave to table a report, the productivity performance of New Zealand public hospitals 1998 to 99 through to 2005-06 by Mani Parathi.
The report was prepared by whom?
The author was Mani Parathi.
Leave is sought to table that document. Is there any objection? There is no objection. Point of order. The Honourable Trevor Mallard. Point of order.
I seek to table a document, or a page of a document from the Crown Ownership Monitoring Unit, which indicates that the advice to the government was significant participation by foreign investors will be essential to achieve the government's overall objectives in its privatisation
Leave
program.
is sought to table that part of that document. Is there any objection? There is objection. That brings to a close questions for oral answer. I call on government orders of the day numbers 1 to 20.